My name is Rohan Talwar. I'm the Assistant Director in Environmental Services at Union Health. Thank you for applying for the position. Housekeeping is a very important part of patient care and patient safety. I always tell people, when you come in, you got to care. When you clean the room, you turn around and look at the room and ask yourself if you were comfortable with one of your family members in the room. If the answer is yes, then you know you did a good job and you're keeping the patient safe. You're going to be meeting Samantha Cornett. She's one of our housekeepers that's been here for over a year, and she's going to give you an explanation of her day taking care of the patients.
Starting, we would get our cart ready and stuff. That would be downstairs, and then we would come to whatever floor, wherever they need us at. Typically we would start with patient rooms, and we would go through, we would introduce ourselves as we walk in and say we're with housekeeping, and if they'd like their room clean. If they do want their room clean, we would go in and mainly get all the touch points, door handles, light switches, stuff like that. We would take their trash for them and whatever else they needed. If the floor needed mopped, we would mop their floor and make sure their room is clean before we walked out. If you walk into a hospital and you would expect it to be clean, that would be the housekeeper's job.
A lot of it was when they come in, they think of housekeeping as cleaning a hotel room. So you come in there, you just make sure the bathrooms, clean, the beds made, and you sweep. But at the hospital, it's more important than that, because you have to interact with the patient. You got to make sure they understand what you're doing. So the scripting is very important, to let them know exactly why you're doing everything.
When you start, you're with someone, so they get to show you what all you need to do, what they'll work with you too, so that makes it easier until you feel like you're ready to have your own cart and be on your own.
For the first 2 weeks, they are in training, so they work with different individuals. So we try to keep them on the same floor, but it's not always possible. But they get the complete training of hands-on. So one of the things we encourage is, on your first day, you've got to jump in instead of just standing and watching, because in the past it's shown that unless you are hands-on, by the end of the 2 weeks you're still confused of what you have to do.
Just be prepared to walk. There is a lot of walking, but when you're doing something, it goes by fast. No, I like it. I get to interact with people. My teammates are pretty cool, and we all work together, and as long as you work together, then you'll be fine.